Hello, this is Dr. Stanley Lang. I have a question to share with you, which I frequently get, which is there an upper age when you can no longer expect diabetes reversal? It's a question I get frequently, and the answer is I saw two patients today who have successfully done that. One lady is in her mid-80s, one lady is in her upper 70s. And I'd like to tell you a little bit about the lady who is in her mid-80s. But first, I want to define that the context for everything that I'm sharing is a whole person health approach. That's health in body, mind, and spirit, which I think enhances the ability to make these lifestyle changes when you address health in all three of these major parts of us. Now, this patient has an interesting history because of many years of experience, both on the program, off the program, and then back on the program. So she had successfully controlled and literally reversed her diabetes using my usual lifestyle strategies of low glycemic eating, using my modified plate technique, and which I've been teaching this for over 20 years. She really couldn't exercise because of some significant physical limitations, but had completely reversed her diabetes. Her A1C was in the 5.5 range. So if you're diabetic, you know what that means. That's pretty good. Then she had an unfortunate injury. She fell, broke a leg badly, required much more surgery than is usually needed. And she had to go into the hospital, obviously, during which time she was fed a diet that is the typical ADA diet, which unfortunately threw her completely out of control. And she had to start insulin because her blood sugars were so high. And then she had to go back from there into the nursing home for long-term rehabilitation. And during that time, she was again fed the typical ADA diet. Her control was lousy. She was on multiple medications and insulin, then transferred to another facility where I no longer had access to taking care of her for several months. Then she came back to the area, and at that time, her A1C was in the 8 range, and that was with medication plus taking significant amounts of insulin. She was angry because she knew how to eat right, but she hadn't been permitted the foods that she knew she needed because she'd learned the program well in the previous years. So she went back on the program that she had learned before, and within months started to see her A1C drop. She was a year ago, her A1C was in the 6.5 range. Now this year, it is now 5.5. She has reversed her diabetes. And this is without being able to do any exercise because of her arthritic limitations. So the point that I'm making is that if one follows these dietary strategies, they will at least dramatically improve the lifestyle, dramatically improve the blood sugars, whether or not you can completely reverse diabetes, but in many cases, completely reverse diabetes. The second patient similarly had just very mild diabetes, completely reversed it in less than 6 months, and has stayed in a reversed state for several years. So the point that I want to make is that if the goal is reversal of diabetes, there is no upper age limit if the person is able to comprehend the eating strategy, which is the foundation. Exercise helps a great deal, but these are two examples where both of these individuals really couldn't exercise very much, and they were still capable of reversing diabetes. So if you have diabetes or you know somebody that has it, and you're wondering, is this person too old to try these things, or will they feel better? Is this diet work okay? It's an excellent way to be living as you get older for a lot of reasons I won't go into. One of them being that the blood sugar being lower is really healthy for the brain, blood sugar high, toxic for the brain. And obviously, dementia is one of the biggest issues as people get older. So getting the blood sugar as low as possible while still being normal is a really good goal to have and achievable by eating this particular kind of a low glycemic diet. Now, there are a lot of other low glycemic diets that probably work just as well. I can't speak to them. There's no research comparing one versus the other. I just know that the one that I've been teaching works. So I wish you well. God bless and have a great day.